Hello everyone, this is Raymond Lee of the Raymond's Dental Solutions. In my last post, I shared with you a vignette about how Emily, a dental receptionist, was able to wow Anna, her patient, with the exceptional service. Today, I'd like to discuss several lessons that can be gleaned from that case study by analyzing some of the details. When Anna first enters the office, Emily gets up and greets her with a wide smile. This initial point of contact between the dental office and the patient is crucial for setting a positive tone for the rest of the visit. What did Emily communicate by standing up and smiling? Respect, friendliness, and courtesy. These nonverbal forms of communication can be powerful tools when used effectively. Through a smile and friendly stance, the receptionist can convey a welcoming attitude and show respect. Particularly, standing up to show respect at a dentist office may be considered over the top in America. Paradoxically, it is for this very reason that such an action becomes more meaningful. Getting up from your chair and talking to patients at eye level can be the most dramatic way to show respect for them. There are other ways of giving a positive first impression. Smiles are a universal system of showing goodwill, and others such as empathetic facial expressions, hand movements, eye contact, and a happy tone of voice can assist in helping the patient feel at ease. Moreover, given that more than 75% of patients who visit the dentist office have various degrees of anxiety or fear, a wide smile can accomplish much. However, the reality is that not a few receptionists offer greetings mechanically, let alone show a wide smile. As exemplified in the conversation between Anna and Emily, Anna's first visit had an important meaning in determining whether or not she would continue to use this dental office in the future. Later, Emily conveyed her encounter and the resulting positive outcome to the rest of the staff, including the doctor, in order for them to continue to maintain the high level of service and even exceed it during Anna's subsequent visits to the office. Notice how Emily guides the patient to the waiting room and shows her to a seat. To Emily, merely greeting the patient and giving them directions to go sit in a waiting area and fill out forms is not the end of her responsibility as a receptionist. She rightly views herself as the staff member who will make the first impression on the patient. So she makes sure that the patient is seated in comfortable surroundings before thrusting a registration form at them. Now let's consider the room. There are sofas, chairs, and a table creating a cozy sitting area. Beautiful paintings are on the wall. A pretty and luxurious teacup set is used, and sweet music adds cheerfulness. Emily helps the patient to fill out the necessary form while enjoying the atmosphere and sipping a cup of good coffee. People may think an excellent quality of service can only be achieved by big things like expensive equipment purchases or the introduction of advanced technology. But the truth is that patients may not really care about those. Instead, they care about small things. They are the attitude, facial expressions, and languages of the staff toward the patients. The quality of physical spaces where patients spend time, such as the waiting room, treatment room, and the restroom. The cleanliness, the quality of materials, and the layout that reflects consideration for patients. Brand name teacups and high-end coffee and tea products. Quality paintings on the wall and cheerful music. A well-organized office. All these little things aim for one thing, to respect and value patients by providing the best. Dr. Benjamin's office created an environment where artistic sensibility is fully reflected in the luxurious waiting room, from bright music to nice paintings on the wall. In addition, Emily offered Anna a beverage of her choice, a Hawaiian Kona coffee, which she expertly brewed and poured in a pretty Lennox mug and brought to Anna. All this so Anna could fill out the document in an enjoyable atmosphere. The dentist waiting room, which often presents a difficult and tedious waiting time, was transformed into a space where the patient could enjoy a pleasant moment. Generally speaking, many dental offices do not make an effort to create such an environment, not because they cannot afford to do it, but because they do not realize just how important it is to provide it to their patients. The truth is, from an economic point of view, such a setting does not require a significant investment, and every dental office can make it a reality if they have the will. Let's now look at the way Emily approaches Anna again right before she finishes filling out the form. This is a different scenario than any other dental office because patients are usually left to remain in the waiting room for a long time without any notice from the office staff, even after the document has been filled out. This sometimes happens even when there is no good reason for it. As a result, most patients are left with a feeling that they are not respected by the dentist office. When Emily meets with Anna at the end, she already knows what happened in the treatment room. This shows that this office has a very good communication system between the doctor and the staff. When the doctor delivers some information to the patients, the receptionist knows it simultaneously so that the final process can be carried out more effectively. Also, it is common to have an awkward and uncomfortable time when patients are returned to the waiting room after treatment. However, in Dr. Benjamin's office, this kind of waiting time is rarely given. Let's see what Emily tells the patients at the end of the visit. She says, since all of her staff know very well that more than 75% of patients come to the dental office with anxieties or fears, they not only do their best to ensure that the whole treatment can be the most comfortable and enjoyable without anxieties or pains, but they also go one more step and pay attention to the patients and try to help them become happier. Here, we can see that the goal of Dr. Benjamin's office is for their dentistry to be one that impresses patients, not just satisfies them. They are doing their best to keep their patients happy by giving a wow experience. So, Emily proposes a program that allows patients to clean their teeth twice a year and precision check the condition of their teeth through one CBCT at a very low price so that patients could prevent major problems in their oral health in advance. Through this program, they help patients to keep their natural teeth for as long as possible and take preventative measures to avoid major problems. This is where patients are most impressed. The target of Anna's first visit to Dr. Benjamin's office was as simple as finding a good dental office in town she had recently moved to and getting regular checks-up. However, Anna received a very satisfactory service from Emily, the receptionist at Dr. Benjamin's office, and was deeply moved to discover that the business really cared for its patients and was aiming to be a place where patients could become happier. Notice Emily's closing comments. All of the processes are finished, and it is now time to say goodbye. However, Emily asks the patients, "Is there anything else I can do for you?" This attitude can be glimpsed in Emily's phone call the next morning as well. By repeatedly reminding patients that the practice is well prepared to help with anything, if necessary, they create a sense of trust and reassurance. The next morning's conversation was first about whether Anna had any problems or discomfort from the treatment from the day before, and second, to inform her of any possible complications in the near future so that the patient could properly be prepared and avoid anxiety. A detailed guide was given in advance, which also exceeded expectations. Today, we looked at how outstanding Dr. Benjamin's receptionist Emily was and how she was able to deliver a wow experience to patients. As I've already mentioned in the other videos, it is not easy to find a qualified receptionist. However, if doctors and staff realize how important the role of the receptionist is in a dentistry office and how much they should invest both in time and money to develop such staff, they should be able to have a really good receptionist in the end. And as well as an outstanding receptionist, excellent quality of service can be created from big things like expensive equipment purchases or the introduction of advanced technology. But patients don't really care about that. Instead, they care about other smaller things of which I've already given examples above. They may be small and trivial things, but they can win the hearts of patients and create a wow experience when doubled with an outstanding treatment by the dentist himself. Next time, I will discuss about how to create an assistant that impresses patients. Thank you so much for watching.